Good afternoon or good morning, and thank you for joining us. My name is Emmy Betts, and I serve as the Deputy Director for the Injury and Violence Prevention Center here on the Anschutz Medical Campus. Today's presentation is part of our monthly Research to Practice webinar series, where we present topics in injury and violence prevention. So before I introduce today's speakers, I want to go through a few logistics. Today's session will be recorded and we will send out the video link to everyone who registered. We'll also put a link in the chat box where you can find past webinars online. We will have time at the end for questions, so please put any questions into the Q&A box and we will hopefully get to a rich discussion at the end. And then please mark your calendars for our upcoming seminars in 2021 and 2022. They're each month on the second Tuesday of the month at this time, noon Mountain Time, 2 p.m. Eastern. And next month's session will be on strengthening trauma care with pragmatic research approaches. But for today, it is my great pleasure to introduce today's speakers. Our session is entitled Climate Change and Workplace Injury, and it's co-sponsored by the Center for Health, Work, and Environment at the Colorado School of Public Health. Today, we'll hear about the connection between climate change and human health, especially how it is applied to injuries among workers, as well as opportunities for further research, education, policy development, and prevention. We have two speakers today who I think are going to be tag teaming in a bit. Our first speaker is Dr. Cecilia Sorensen of the Columbia Mailman School of Public Health and Irving Medical Center. She'll be presenting evidence linking climate-related exposures to workplace injury and policy goals to address these risks to worker health. She will also present on educational needs and opportunities for the occupational medicine community. Dr. Sorensen, or Cici, is the director on the Global Consortium on Climate and Health Education at Columbia University, and she's an emergency medicine physician investigator in the area of climate change and health. And I had the great pleasure of working with her when she was a resident here in Denver. Translating research into policy, clinical action, and education in order to build resilience in vulnerable communities is the focus of her work. Her recent work has spanned domestic as well as international emergent health issues related to climate change, including heat stress and worker health in Guatemala, wildfires and healthcare utilization in the United States, the emergence of the Zika virus in Ecuador following the earthquake of 2016, climate change and women's health in India, and mortality following Hurricane Maria in Puerto Rico. She has served as an author for the U.S. Fourth National Climate Assessment, and she serves as a technical advisor for the Lancet Climate and Health U.S. Policy Brief. She's also a member of the Colorado Consortium for Climate Change, a scientific advisor for the Citizens Climate Lobby, and the course director for the nation's first medical school course on climate change and human health. And she also co-directs the National Climate Health Fellowship Program here at the University of Colorado, which is a post-residency training program for physicians. And our second speaker is Miranda Dally of the Center for Health, Work, and Environment, and she'll be presenting on evidence suggesting a link between working in hot environments and increased risk of occupational illnesses and injuries. She'll also be discussing the needs for increased surveillance and the importance of workplace interventions. Miranda is a research instructor and a DRPH candidate at the Colorado School of Public Health. She grew up in Northern California, so she's seen firsthand the detrimental effect that climate change has had on workers and their communities. As the co-founder of the Climate, Work, and Health Initiative, she is dedicated to keeping workers and their families safe, healthy, and productive by preventing and reducing health impacts from the changing climate. Her research examines the ways that changing occupational hazards due to climate change affect agricultural worker health and well-being, specifically how increases in occupational heat exposure lead to injury, illness, and impact the ability to work. And she takes this research into practice by working closely with employees and their employers on ways to protect and sustain the health of workers who are responsible for the global food supply. And so we are so thrilled to have these phenomenal speakers and practitioners with us today, and I'm going to turn it over to them. Thank you for joining us.
Thank you so much, Dr. Betts, and thank you for everyone for joining us today. My name is Cecilia Sorensen, and I'm going to get us started today Just a quick overview as to where we're going. I'm going to be starting by talking a bit about climate change and worker health, and then I'll turn it over to Miranda, who will talk about heat and occupational illness and injuries, as well as workplace interventions. And then I'll take it back over again, and we'll talk about policy opportunities and perspectives. And I really look forward to all your questions and comments, and we'll be monitoring the chat. So at the end, we can bring your questions to the forefront and hopefully have a great conversation about them. So just to step back a little bit, when we're thinking about climate change and human health, there's several different areas that are important to look at. So as we all know, the climate is changing, but when we're thinking about health, what we want to do is be able to understand how changes in climate really are transcending into the health impacts that we can measure. So we look at things related to climate, which we call exposure pathways, and those are rising temperatures, more extreme weather, rising sea levels, rising CO2 levels. And these in turn lead to things like air pollution, things like changes in vector ecology, increased allergens, water quality impacts, food and water supply impacts, environmental degradation, extreme heat, and severe weather. And as you can see, we're getting closer and closer to health. And then when we think about what happens when there's poor air quality, well, we know that leads to issues such as asthma and cardiovascular disease. When we think about changes in vector ecology, we know that can lead to increased prevalence of malaria, of dengue, of different types of encephalitis, of hantavirus. When we think about increasing allergens, it leads to issues such as respiratory disease and asthma. And when we think about water quality impacts, diseases come to mind such as cholera and cryptosporidium and so on. And so when we think about climate change and health, what we're really doing is we're taking a lens of environmental exposure, and specifically environmental exposures that are changing as a result of climate change. And we're asking the question of how are these changing exposures ultimately impacting human health? And so with that in mind, it's important to know that when we're looking at a pathway of exposure, so for example, extreme heat and how that impacts health, the ultimate impact on an individual's or a community's health is not necessarily linear. So for example, if there's a heat wave, that does not necessarily mean that every single person in a community is going to become sick, correct? Right? We all agree that. The reason why people become sick and the way we can sort of understand this is by looking at different frames of vulnerability. So there's different ways of sort of thinking about this. And so the first category we look at is what is the actual climate exposure? And that exposure would be sort of how does the climate factor actually have an impact on the community? What is the degree or the severity of the exposure? Then we can look at the sensitivity of the individual or the community. So for example, does that person have underlying health issues? Are they very young? Are they very old? And so on. So what is the sensitivity of the person? And then we can look at their adaptive capacity. And that's maybe a little bit more abstract, but it's basically the question of how well can a community or an individual respond to an exposure to protect themselves. And so oftentimes an example of this would be, for example, their socioeconomic status. So if there's a severe heat wave and you have air conditioning, you have high adaptive capacity. You're able to prevent yourself from getting injured by the heat. Whereas if you do not have air conditioning, you would have low adaptive capacity. So when we're thinking about climate change and health in general, it's important to understand that not everybody has the same degrees of vulnerability. So now when it comes to worker health, right? We know that climate change is impacting health in general, but that workers are a very specific population that has a lot of unique constraints on their behavior and on their health. We know that worker populations in a variety of geographic areas are very vulnerable to negative health impacts from climate change, either because of the nature of their profession. For example, are they firefighters? Are they emergency responders? Or because maybe they have pre-existing health conditions. We also know that workers are at a higher risk than the general population because they are disproportionately exposed to environmental conditions that the general public can often elect to avoid, but that workers must endure because of the nature of their work and because of their need to, come home with a paycheck at the end of the day. And so for this reason, workers in general have been referred to as being like the climate canaries, right? Like the canary in the coal mine, because they're expected to be, and we observe them to be, the first members of a population to begin to exhibit illnesses due to new and unique climate-related exposures. And so what I'd like to do is give a few examples of that so you can sort of see how this has been playing out. So we'll start by looking at extreme weather events. So we know that the frequency of weather-related disasters, including hurricanes, flooding, and wildfires, is increasing due to climate change, with resultant increased exposures to a multitude of health hazards. So when these events happen, most citizens attempt to evacuate or they shelter in place. However, many times workers end up on the front lines. They're saving lives, they're part of the rescue and the recovery, and they're part of the rebuild. So when we think about affected worker populations, we think about first responders, we think about medical workers, we think about law enforcement, engineers or construction workers, and more. In the aftermath of extreme events, we know that workers are exposed to physical trauma. They're exposed to issues related to electrocutions and drownings. They're also exposed to lots of toxic chemicals, as well as biologically contaminated waste. And we also know that workers who are exposed to trauma and have their role as a responder can experience mental health issues as a result of this due to vicarious trauma. So just for a reference point, this is a graphic showing where billion-dollar climate-related disasters occurred in 2020. And this is data which is gathered from NOAA, which is the National Oceanic and Atmospheric Administration, and they track these disasters very closely. So just in 2020 alone, there were over $16 billion climate-related disasters. So those are disasters that led to over $1 billion in property damage each. And then when we look at sort of the trajectory of where disasters are happening and how they're increasing, it's not hard to see that there's a trend towards there being more and more extreme weather-related disasters. And the last bar here is 2021, and this data is old, but it's looking like 2021 is going to be equally on par with 2020 in terms of its at least property damage costs from extreme climate and weather-related disasters just in the US alone. We also know that workers are disproportionately exposed to degraded air quality, which is becoming worse in a changing climate. So as we all know, combustion of fossil fuels leads to fine particulate matter, which is the really, really tiny stuff, smaller than your hair, and also creates ozone when it comes in contact with heat. And this is intensified by rising temperatures. So we're being exposed to more poor air quality. And we know that workers are disproportionately affected by this because in industrialized societies, 95% of people's time is usually spent indoors, where sometimes, but not always, there's better air quality than there is outside, especially in areas of heavy urban traffic or rural sources of air pollution. So when we think about workers who may be affected here, we think about outdoor workers, we think of agricultural workers, construction workers, delivery workers who are in trucks idling all day. And then we think about workers who are sensitive to this, such as workers with underlying respiratory or cardiac disease. And then, I think one example that's really important to bring up is the issue of wildfires, right? Because we've been seeing more and more of these over time, and firefighters are on the front lines of this. And so their health is being threatened. So exposure to poor air quality, as we alluded to earlier, can result in primary development of lung disease, as well as exacerbation of existing lung disease. It also has been found to be a factor which can accelerate cardiovascular disease, such as atherosclerosis. And in pregnant patients or women, I say patients because I'm a clinician, pregnant people can lead to premature can lead to preterm delivery, as well as low birth weight infants. So we know that exposure to poor air quality is a risk factor for a multitude of different health outcomes. And so just to give a couple of examples, let's think about fires, right? In the past decade, we've seen a gigantic increase in the frequency as well as the intensity of wildfire days in the US as well as Canada. And we know that exposure to poor air quality results in the region where the wildfire is, but also that poor air quality can travel thousands of miles away downstream, right? So over the summer, there was it was about a week of really poor air quality days in New York City. And that was a result of wildfires that were happening in California. So even though we don't see any wildfires in the East Coast, we are still being affected by poor air quality from them. So there's been some data looking at wildland firefighters' health. And what we're finding is that they're experiencing a lot of oxidative damage in their cells. And they're also having a lot of issues with lung function, right? And what we're seeing is that there's more and more wildfires, and we're going to need to be putting more and more people on the front lines to fight these fires. So how are we going to be able to take care of their health, right? In this situation where climate is changing. We can also think about vector-borne diseases. We know that changes in temperature as well as precipitation and ecology are altering the geographic distribution of vector-borne diseases. In North America, that includes things like Lyme disease, like West Nile, and various different encephalitides, as well as hantavirus. So workers that may be preferentially affected by this include sanitation workers, demolition workers, people working in food or animal production, as well as agricultural workers or people working in landscape. And then in terms of sensitivity, depending on where you fit into the demographic spectrum, for example, pregnant women, we know when they get infectious diseases, especially vector-borne diseases, it's not just them who gets affected, it's potentially their unborn children. And so when we're thinking about worker health and we're thinking about professions which are particularly sensitive, we need to be thinking about how climate change is changing their exposures and what we need to be thinking about and what we can do to protect their health. So this is just an example. It's a slightly outdated figure, but what we know is that the incidence of vector-borne diseases has been increasing over the past decade. It's actually tripled in the past 13 years. And these are diseases that are carried from mosquitoes, ticks, and fleas. And so we're seeing a huge rise in the case numbers of vector-borne diseases in the US. And this is just up to 2016, but the trend continues. And so if we look just at Lyme disease specifically, on the left, we're looking at reported cases of Lyme disease just in 2004. And you can see that it's really concentrated mostly on the eastern seaboard with some scattered cases up around the Great Lakes. But then when we look at 2019, there's been a massive increase in cases of Lyme disease. And a lot of this has to do with the fact that winters aren't as cold as they used to be, and we're not getting the same die-off of ticks, right? So the relationship between climate change and vector-borne diseases is complex. It's not just climate variables. It has to do with also human behavior and the fact that we're encroaching more and more into previously undisturbed habitat. But in general, what we're seeing is that there is a strong climate signal in these spreads, geographic spreads of vector-borne diseases. The last impact I want to talk about is that on water quality. There's been a huge shift in rainfall patterns associated with climate change, where we're sort of seeing this paradox where in some areas, places are getting more and more and more dry, where other places they're getting extremely more wet, right? And so this balance is sort of creating a disequilibrium in the ecosystem. So when we have these things that are called heavy precipitation events, that's basically we're thinking it's just raining like cats and dogs to the point where it's overwhelming our ability to manage runoff, for example, in urban areas. What that ends up doing is it ends up exposing people to a lot more toxic burden, as well as biologic contaminated water that can get into our drinking water, as well as our recreational waters, and potentially expose us to pathogens. So workers that may be affected by this are sanitation workers, our first responders, and especially older workers and immunocompromised workers. We've also been seeing that because of sea level rise, that there's been an increase in seaborne pathogens, for example, cholera, and that includes the gastrointestinal form of cholera, but also the types of cholera that can cause wound infections. So people who are working on coastlines can be preferentially exposed to these. So, going back to this figure, when we're looking at this again and we're thinking about these examples of worker vulnerability in a changing climate, it becomes clear that workers really have a significant disproportionate exposure to climate-related health risks. And these risks really, really greatly depend on the nature of their work. So it's important that I think, we really are changing the way that we think about worker health. And we have to sort of undo the assumptions we have about how the environment is behaving and what professions are leading to what exposures. And so with that, I will turn it over to Miranda.
Great, thank you, Cece. So as Cece said, we have to think about these different vulnerabilities of how climate is going to impact workers. And we can't think of work as just a single silo. So we go to work, we spend a lot of our lives at work, but we also have lives outside of work. And so experiences that we have in both our community and our society and how climate impacts each of those will impact our vulnerabilities that we take with us to work. So this is a framework that we've put together to just kind of look at that. And what I'd like to do now is to take us to the big elephant in the room that Cece hasn't touched on, which is heat. And so if you go to the next slide for me, Cece, and you just kind of click through so that these pop up. I think that, you know, as you've been paying attention to the news this summer on top of COVID, it seems that more and more we've had headlines about workers dying because of heat exposure. This is something that has been going on for a long time, but seems more prevalent now. And so when I did a Google search, just putting together these slides, these were like the first 6 hits that came up when you just look at heat and worker death. And it's, you know, all of these were from July and August of this summer. And so this is not anything that's going away. We have this exposure in the workplace that's actually killing workers. But before we get to that point, there's a bunch of other things, a lot of other health effects that heat exposure is going to have for workers. And so Cece, if you go to the next slide, I want to talk about how heat impacts injury risk. And so there've been some studies recently that have come out that show, regardless of what occupation you're in, whether or not you're sitting in an air-conditioned office, if you're an agricultural worker out in an orchard picking apples, that increasing heat will have an effect on your injury rate. And so by looking at workers' compensation claims, researchers have been able to establish that for every degree increase in temperature, the risk of injury increases by 1%. And so when we think about this in the context of climate change, if we're seeing that temperatures are continuing to increase, we would expect to see the number of injuries increase unless workplaces are able to do something to adapt to those to this increasing exposure. And so what I'd like to do now is talk through a little bit of the research that we've done in the center and provide some recommendations that we have for workplaces and how they can protect their workers with this changing environmental exposure. So if you go to the next slide. So to orient us, before we can talk about ways to protect workers, we kind of have to understand about what's going on. And so the way that heat is affecting us is that the human body has a core body temperature that it is maintained to design, or is designed to maintain. That temperature is 37 degrees. However, when you work, your physical exertion can increase your core body temperature, and you can have additional factors such as the personal protective equipment that you're wearing that can contribute to the rise in your core body temperature. And what happens when your body temperature starts to rise is you can become dehydrated and you can experience heat cramps. You can start feeling fatigued, you can have weakness, and then you can have heat stroke, which is when we talk about deaths from environmental heat exposure, the workers are dying from heat stroke. And so when we think about this in terms of what's happening with occupational injuries, the core body temperature rises are leading to reduced cognitive function and reaction time, which can then lead to occupational injury. So what can we do about this? Next slide. So the first thing that we need to do is surveillance. What I mean by this is workplaces need to recognize the signs and symptoms of dehydration, and they need to have their workers record, and workplaces need to treat dehydration like any other occupational injury. And the reason I say this is we partnered with a large agribusiness in Central America around a water, rest, and shade program. Part of the program components were educating the workers on the importance of hydration strategies that they can take, as well as educating the business. And so what we did was we worked with the business to provide the workers water. And as part of the evaluation of this program, we had the business start tracking reports of dehydration. And what we saw was that from 2014 and 2015, when prior to this program being implemented, the total injury rate, regardless of what injury type was happening, was about 2 per 100 workers annually. When they started this intervention and started really recognizing what dehydration was, we saw dehydration being reported at a rate of 2 per 100 annually. So this is suggesting to us that dehydration was happening almost as frequently as any other injury. And this is really important because dehydration is the first step in being able to intervene. So if we stop dehydration, we can hopefully, we're intervening earlier on that pathway to heat stroke. So the recommendation is that workplaces have to increase surveillance. They have to educate their employees so that their employees know what the signs and symptoms are, and they need to educate themselves and take this seriously and allow their employees the ability to report this and say something. Okay, next slide. So recommendation 2 is to increase access to clean water, electrolytes, rest, and shade. And I found this quote recently that I really liked, especially in light of the potential new OSHA rules and regulations coming out about heat. But it says, at the end of the day, our interest is less that employers are getting fined and more that workers are getting rest breaks. It's about a culture change. And why I think that this is really important is that if you think about the agricultural fields that the workers that we work with are in, these things are massive. And so if you're at one end of a football end zone and you're working and you have this quota that you have to make, you have a certain amount that you have to do, and you are already behind, are you going to stop your work and walk all the way to the other end zone to go get your water and then come back? So we have to think about these interventions in terms of not just putting the onus on the employee to make the decision between stopping work and getting water, but rather having these be employer supported decisions. And so employers need to implement policies where workers are allowed to take rest breaks, that they are encouraged to take rest breaks, and that they won't be penalized to take rest breaks. So if you can go to the next slide, Cece. So one of the foundations of this recommendation that we had is that when we came into the business and we had suggested, this water program, what we saw was that employees were actually starting to overhydrate. They were drinking too much free water. And so we worked with the company to refine that recommendation so that employees would start drinking more electrolyte beverages. And so the Gatorade types of things. And what we saw was that as employees started drinking more electrolytes, they had a reduction in a value of something called creatine kinase, which is a measure of muscle breakdown. And so we saw that the electrolyte consumption versus the water consumption was protective in that workers were then experiencing less muscle breakdown. And what the outcome of this was that the company then invested in providing electrolytes. And so again, we put the responsibility on the employer to do this for their workers. It wasn't that employers were telling workers, you need to come to work with more electrolytes and take it. It was something that the workplace integrated into their processes and were able to provide the employees. One of the things that was really important about the evaluation of this was we solicited employee feedback about how the process of drinking more electrolytes went. And what we actually found was that despite showing that 10 liters of electrolytes were most protective, employees really struggled with drinking that much water. And so we made the recommendation of, that many electrolytes, we made the recommendation that they drink 5 liters instead, just because some were experiencing some headaches, like it just didn't feel good. And then one of my favorites was that the workers really hated the grape flavor. So we were able to recommend to the company, like, get rid of the grape flavor, because if you're providing a flavor that people hate, they're not going to drink it, right? So I use that as an example to talk about when we create these programs in the workplaces. It's not just what's feasible from the employer's perspective, but it's also including the employees in the discussion so that employee feedback is incorporated into what's being done. Because if employees aren't on board, or if you're suggesting something that's too difficult for the employee to do within the confines of their job, they're not going to do it, and the program's not going to be successful. So next slide, please. And then this leads to my third recommendation, which is involve employees, which is arguably the most important. And I want to talk a little bit about the psychological factors that drive employees' behaviors in participating in these programs. And these include job demands, their precarious nature of work, and their safety culture around heat as an exposure. And so what do I mean by this is the job demands. This is what I was talking about with providing access to water. You know, a lot, especially in agriculture, workers are paid by how much they produce. They have certain quotas that they have to meet. And so they're often put in a position to decide between health protective behaviors, taking rest breaks, taking time to go drink water, versus producing so that they can get the paycheck that they're expecting at the end of the week. Similarly, the precarious nature of work. This is especially true for a lot of migrant farm workers. You know, they feel that they do not have job security. And so a lot of workers are put into a position of not wanting to be the voice that speaks up about something being wrong to the employer for fear of retribution. And then safety culture around heat as an exposure. I mean, part of this is that people, it's a risk that they think is just part of the job. And so they think that because they do work outside, it's inherently part of the job, and they have to, I guess, accept that. And so it's, how do we work around it? How do we work with the workplaces to show that, you know, while you're not going to be able to cool down the outside, there are things that workers are supported in doing to help protect themselves. And the reason I have a case study to talk about why it's important to communicate with employees and involve them in the decision-making process. One of our recommendations with the company that we were working with was to reduce the workday from 8 hours to 6 hours. And so having workers in the field for less time. We piloted this study, and what ended up happening was that while workers were in the field for fewer hours, we actually saw that they were producing the same amount of sugarcane than if they had been working 8 hours. And so there was a failure to communicate to the employees the expectation that they could cut less sugarcane. And so the employees felt like they had to maintain the same amount of productivity over 2 fewer hours. So, you know, we saw that and we cut that trial off. That was a no-go. But it's really, it just demonstrates the importance of communicating with the employees and soliciting employee feedback for what would be a practical program to implement. So then next slide. Finally, it's just going to be really important for workplaces to have a workplace heat injury prevention program. And so thinking similar to an emergency preparedness program, having something on record that talks about how you're going to respond to heat injury, or if you have an employee who's starting to show signs and symptoms of a heat-related illness. And so these include things like involving the employees in crafting it, ensuring if any uniforms are required that employees wear, that they're designed appropriately for the intensity of the work that they'll be doing, environmental monitoring at the work site, ensuring heat acclimatization of employees, reconsidering pay structures and requirements of employees, ensuring that workers have access to clean drinking water, encouraging the reporting of dehydration, and examining return to work programs for employees who have suffered a heat-related illness. So, you know, what does that look like when they come back to work? What kind of acclimatization do they need? Is there modified duties that they could do until they become acclimatized again? So these are all just things to consider when crafting that prevention program. Okay. And with that, I would just like to end on a call, gaps and needs. You know, a lot of this, despite it seeming fairly, you know, I don't want to say obvious, despite there being a need for all of this, we still need willing employers to help us pilot and assess the effectiveness and the efficaciousness of these kinds of programs. You know, we need to implement, we need to evaluate, and we need to disseminate programs. And so this is just kind of my call out there for employers to ensure that they're involving academic partners in assessing whether or not these are effective strategies. And I believe it's going to turn back to you now, Cece.
Okay, thanks so much, Miranda. Thank you for all those examples, because I think that really helps frame kind of where we're going with this. So I want to talk a little bit about climate change policy and worker health. And, you know, I'm going to sort of frame this from that diagram I showed earlier, looking at, you know, how do climate-related exposures ultimately translate into health impacts, and what mediates that? So to start thinking about this, we need to start thinking about the actual exposures that are happening. And, you know, one way to think about that is to look at climate change and look at climate mitigation, to really step back and say, you know, our climate is changing broadly, and we need to rapidly change the way that we are functioning on this planet in order to prevent worsening climate realities in the near future. And so the way we do this is to support a rapid transition to a low carbon economy. We can do that as individuals, we can do that as institutions, and we can do that as governments. And there's different ways that even individuals can act in each of those capacities in order to improve the future of climate change on this planet. The second thing we also need to look at is to really, you know, re-examine worker safety. So despite convincing evidence for negative health effects due to increased workplace heat, there's currently no dedicated federal standard which specifically addresses occupational heat exposure. And I can assure you there's also no policies which address exposures to vector-borne diseases or to you know, infected water or poor air quality, right? So we're very much at this nascent stage in starting to understand, but then also starting to implement policy regulations which are seeking to protect worker health. So the fact that there's been no federal heat standard for basically forever in the US has caused a lot of advocacy agencies to really step forward and to strongly recommend that regulations be put in place. It's exciting to see that as part of the Biden-Harris administration's interagency effort, they are committing to workplace safety. And very recently, they announced that they will be enacting enhanced measures to protect worker health in hot environments. OSHA is the arm of the government which is going to be implementing this. And they're going to be looking at heat-related hazards and developing a national emphasis program on heat inspections and launching a rulemaking process to develop workplace heat standards. So this is really exciting because this is honestly the first time that there's really been any large push on behalf of the federal government to enact a federal heat standard. Despite that, we have seen a few states have put forward heat standards, but never has the federal government done that. So this is going to be a really interesting policy initiative to watch. I would note that in the US, where we probably have one of the safest worker health environments, we don't have a heat standard. So if you can kind of imagine how worker health is treated in even less regulated areas of the world, I think it's very important that the US be leading on this, and we be sort of showcasing, how we can protect worker health in a changing climate, with the hope that others will adopt similar types of recommendations and regulations. We also need to think about how to improve data and modeling on climate and environmental exposures in order to translate this knowledge into practice in order to minimize risk. And this basically goes hand in hand with increasing surveillance for workplace exposures that stand to worsen in a changing climate. So one example I'll give of this. So Miranda and I have done work together in Guatemala looking at heat stress nephropathy in agricultural workers in sugarcane industries. And, what we see are very young workers, from the age of like 20 to 30, who are going into end stage renal failure as a result of what we think is probably a multifactorial model for how their kidneys are failing. But one of those factors is very likely to be heat and chronic dehydration. So we see this as almost an epidemic in Central America. However, as an emergency medicine doctor in Colorado, I've seen this too in populations who are coming in to the emergency room. For example, a young, otherwise healthy person comes in with pneumonia, and for some reason, someone sends a basic metabolic panel on them, and why is their creatinine 3? Right, 3 is bad. They've got poor kidney function, and if you go back and talk to them and take an occupational history, you learn that they've been working in agriculture, for the past 2 decades. So long story short is that these impacts are happening in the workplace. We just don't have surveillance systems that are set up to detect them. So one of the main things we need to do in a changing climate is that we need to increase our surveillance of workplace injuries. And then we need to improve communication. And Miranda, you touched on this, improving communication to workers is incredibly important so that they can take health protective and health promoting measures. And we need to get our messaging right. For example, one of the things that we saw a lot in Guatemala were that workers would, obviously they're cutting sugarcane in the fields all day, and they're in a lot of pain. So they're taking NSAIDs, things like ibuprofen and Motrin, which are very, very bad for your kidneys, right? And so are we able to sort of provide a safe alternative to taking those types of medications because they need something for pain? And so are we getting our messaging right when we're talking to workers? We don't just want to be telling them you can't treat your pain. We need to be providing them with alternatives. So really understanding what work is like for people and how we can help them to be as healthy as possible. And as Miranda mentioned, a lot of this does fall on employers. And, I think that there's different strategies of going about this. I think a punitive way is not necessarily the best way to do this. I think having a cooperative work with employers is really the best way to go about this in order to really sort of have the most impact. We also need to think about the sensitivity of workers and considering that there's huge heterogeneity among worker populations. And so again, heat is a great example. So we know that workers, for example, who are undocumented in the US suffer much higher rates of heat illness and disease. And the factors that are contributing to this are multifactorial. Air quality is another great example. And again, this sort of comes back to this idea of total worker health. So if workers are leaving their job and returning to home environments that exacerbate existing exposures at work, they're going to be suffering greater injury than would initially be predicted just by the exposure from the work alone. And so we really need to be kind of thinking about worker health in this sort of holistic view of, yes, workers are exposed to hazards at the workplace, but then what happens after they go home? And how does that improve their health, or how does that make their health worse? And, workplaces are places where people get a lot of information, especially as adults. It's where they do a lot of their adult learning and where they sort of form their culture of knowledge. And so if we can sort of implant more health promoting behaviors and knowledge into workplaces, the idea would be that people then have a greater health literacy and can go home and take actions to protect their own health. So when we're thinking about sensitivity to climate change, we know that socioeconomic status is a huge is a huge risk factor. We know that race and ethnicity also are, that immigration status is, as well as pre-existing health conditions, as well as pregnancy status and gender. So these are things we need to be thinking about as we're thinking about communication, research, and surveillance. And then when we consider adaptive capacity as a mediator of health impacts, we also need to consider the adaptive capacity of workers, but also the adaptive capacity of work environments and of the occupational health system, right? And as we're looking at this, how do we sort of address and how do we understand how adaptive systems can be? And what really underlies this capacity to adapt includes in individuals or in organizations, their assets, their flexibility, the organization's connectedness or interconnectedness and how well the organization is running, people's ability to learn or organization's ability to learn, as well as the agency of the individual or of the organization. So I'm presenting this more as sort of a framework to think about, we need to bolster adaptive capacity of individuals, of workers, but also of companies and of the occupational health system. And when we're going in and trying to sort of change these systems, there's many different areas that we can and should focus on. And lastly, I want to sort of mention something about the role of occupational environmental medicine practitioners in the climate crisis. And I would say that, perhaps more than any other health voice, OEM providers are in this very unique position to advise employers on workforce health within the larger corporate context, which can really lend itself to consultation on really, global wide scales to address climate-related health effects. And additionally, it's important to note that, cooperation between corporations and public health is going to be one of the best ways to really bolster our ability to track and monitor climate-related health effects using existing and novel surveillance systems. I think it's also very important that as practitioners, as health providers, that we have a context for understanding work. As an emergency medicine practitioner, our time is very short in the ER with patients. But, I think one question we can ask and that perhaps we should ask of all our patients, no matter where we are, is, what do you do for work? Because work, as we're going to see, is going to continue to have an increasing impact on people's health. And it's something that all of us sort of need to be aware of on some level. So those are just some thoughts about policy and about how we can start taking steps forward. We've got a couple slides to thank some people here who have contributed greatly to these collaborations. And we encourage you all to stay connected to all of our various activities. So that's what we've got for you today. And we welcome all your questions and comments. So thank you.
Oh, thank you both so much. That was so interesting and really fascinating to sort of put different disciplines together that we might not always think about in the same way. So there are a couple of questions. So let's just jump in. Hang on one second. So the first one, sort of thinking about the practice part of it. So can you describe what heat acclimatization might look like in a workplace? Is it structured pacing by leaders? Is it informal allowance for workers to ramp up as they feel capable? Something else? Thank you.
You want me to take this, Cece?
Yeah, you got it, Miranda.
Okay, so a lot of work on heat acclimatization in the workplace has come out of actually military training. And typically the recommendation is when a worker begins a job, so they're a new worker, you just hired them, or when they've come back from an extended period of time of not having worked, because you can lose your heat acclimatization, that you should, over the course of 2 weeks, slowly ramp up the amount of work that they are doing. And so, if in the case of sugarcane harvesting, if it's cutting 6 tons of sugarcane in an 8-hour day, that's the target at the end of the 2 weeks, then over the course of those 2 weeks, you'd have them working, a few hours the first day, a couple more hours, and you build up to that. So the general rule of thumb is about 2 weeks. That said, a lot of that's coming from the military field, and there hasn't been a lot of work that I'm aware of in more specified industries, so like construction or agriculture.
Thank you. All right. Next question As our economy hopefully shifts to lower carbon, what do we know about the relative safety or risks of some of the newer kind of greener jobs, like working on solar farms? Any thoughts there?
Yeah, that's really an interesting question. Miranda and I are both smiling because we spent a lot of time trying to look into this. And honestly, we don't know a lot. I would say, Miranda, I'm here to say, but like we've both looked into this and there's just really no data. I mean, and it's lagging. We don't know what the impacts are. I would say one of the things that I've been keeping an eye on and being sort of interested in is that, as we're looking at, for example, batteries require tons of lithium and other heavy metals in order to make them. And so where does all that mining and extraction happen? Well, it happens in South America, it happens in Bolivia, it also happens in Africa, it happens in the DRC, it happens in places where there are very little regulations. And oftentimes, discovery of these precious minerals results in a lot of conflict in these areas. And so, as we're moving over to a green economy, it requires a different set of like fundamental elements and materials, and where are we getting them from? And so, I think, we're focusing on, yes, we are in the US, but we live in a globalized economy, and we need to be thinking about where these minerals are coming from, because I think the impacts and the human rights issues related to that are some of the most concerning. So.
Yeah, and I would build on that. So it's, what are the health effects of the exposures? What are the best ways to protect workers who are going to be working with those different elements? And it's considering just, the structure of these new jobs. They're going to pull pieces of risk from all sorts of different jobs. And so, you're going to have the typical risks that you would with construction. You have the risks that you have with working with electricity. And so I think not losing sight of the traditional safety standards that we have for workers and thinking about how those apply to these new jobs will be important.
That's great. Thank you. It makes you think about sort of broadly, right? When we think about worker health, how is that impacting community health and student health, and right, like the sort of principles of universal design, but then also not forgetting everything we've already learned just because a job is in a new industry. So there's a question here that's around the Pacific Northwest, but maybe you guys can comment more generally. So Oregon OSHA has a new emergency heat standard, action levels at 80 degrees and 90 degrees Fahrenheit, which, for those in the Pacific Northwest is really hot and not sort of what they have been used to. But so the question is, are there specific temperatures, for example, in that area where people definitely shouldn't be exposed? But I'd like to broaden the question, are there certain levels above which, no matter where you live, no matter where you're used to, you really should not be out working in the heat? And how do you tailor things for different sort of parts of the country?
Yeah, that's a really great question. So NIOSH has published this table. I can just share my screen here real quick because I saw this coming, this question. Can you see my screen?
Mm-hmm.
Okay. Yeah. So they've published this table where basically, depending on the temperature, you adjust your ratio of work versus rest. And so it looks like at above 111 degrees that you should take caution at all levels, right? Which is really hot. I mean, I would think that this should be a lot lower, right? And so it's really interesting that Oregon is basically saying at 80 degrees, we have to start thinking about this. And that goes back to what Miranda was talking about in the question before about acclimatization, right? I mean, this seems like this is a very, seems like it would definitely not apply to the Pacific Northwest. And so again, I think what this is showing is that, different populations have very different levels of vulnerability. And so I think it's really good that Oregon has set a very conservative limit. And I think a lot of that was a result of, unfortunately, of the Pacific Northwest heat wave that happened this year, which showed that even temperatures, which to people who are used to heat are not that hot, when you have an unacclimatized population, it is just so dangerous. Mm-hmm. I would add that it's not just absolute temperature, but it has to do with the heat index. And heat index is a combination of humidity and temperature. As you all know, if you've ever been in the East Coast in the summer, like it's disgusting, right? Like it's so humid, it's so hot, so different from dry air and heat in Colorado, right? And so the heat index is also something to take into account.
And the other thing I just want to add to that too is, I mean, it's great that the Pacific Northwest has these conservative standards, but the practicality of some of these standards in regions of the world where they are experiencing much hotter, you think of the Dubais and Central America and stuff like that. A lot of these places look to the US for their safety standards. And if our safety standards aren't practical to them, we need to do more to come up with practical solutions for them. And so I think that at the end of the day, there will need to be more regionalized recommendations, I think.
That's a great point. I lived in the UAE for a year, a long time ago, and I remember that experience of getting used to the heat and how life is just different, that the cycles of when people do things. And I remember in particular during the period of Ramadan, when thankfully the year I was there was in the winter, but it definitely changed people's activities because they weren't drinking or eating during the day. And so then thinking about sort of being out in the heat. So as we think about different areas, but also different seasonal variations, whether it's for religious or other sort of cultural traditions and things, it's really complicated. And it's so wonderful that you guys are doing this work and hopefully helping connect to broader global communities. Yeah. Do you, Ashley, just put a reminder in for our participants if you want to come to our next one in November. Curious just to turn it over to you two, if there's anything else you want to leave us with, any last thoughts?
Miranda, what do you think?
My last thought is, no, I'm going to put a plug in that I think, the employers, regardless of what the federal regulations are, really need to take action on this. And, they need to partner. They can help advance the science on this. There's still a lot we don't know and that we need to figure out. And so, it's a call for more academic and employer partnership.
Yeah, I would agree with that. Yeah, I think it's, the issues related to climate change and health are so widespread and so insidious, and everyone is going to be impacted in some way, in some way, shape, or form. And, I think the more we know and the more we're aware of it, the more we can look out for it for ourselves and for our loved ones, as well as people who we are charged to care for, so lots more to come. And yeah, thank you all so much. This was really fun to chat.
Wonderful. Thank you so much for joining us. Thank you to all of our attendees. And we will send out the link for those who want to see it again or share it with your networks. Thank you so much. Be safe and stay cool.